Thank you. We have time for one more question. I'll tie together two questions from the audience. It actually stems from the last comment, Dr. Petrillo, that you were making, and it's a question for both of you. Very curious about how to deal with fatigue, which is a common side effect with a lot of targeted therapies. The question reads, I often read about methylphenidate being prescribed. Could you tell us about some safety and reasoning behind this prescription? How effective is it? And then there's also optimal pain control techniques and why sometimes additional medication might be needed to help with breakthrough pain.
Sure, I'm happy to start with that. We don't have great evidence-based approaches to fatigue. There are some good things in being studied about kind of behavioral approaches, and behavioral approaches is usually one of the first things that we talk about with people. So thinking about how to conserve energy, how to use your energy, prioritize during the times of day that feel like the right times, and then troubleshooting around nighttime sleep, around nutrition, around things that might contribute to energy is usually my first approach. We do use medications, the stimulant medications. The data are sort of mixed about effects on fatigue, but anecdotally, I've had some people really respond, some people don't notice a difference, and some people get kind of some anxiety that's triggered by those medications. So the things that we have to think about as risks for stimulant medications are histories of arrhythmia, and then also a history of anxiety, just knowing that it can make it worse for people. Sometimes we will just try, and then sometimes the risk-benefit balance of the arrhythmia risk is, in favor of trying if somebody has really low energy and wants to try something for fatigue. The other thing that we think about sometimes in certain select situations is steroids. People may notice a boost in energy on the days that they're getting steroids when they're getting chemo, for example, and we take advantage of that. And sometimes we'll use selectively steroids, again, something with a ton of side effects, so something we're very careful about. It's a risk-benefit balance consideration. But methylphenidate is something I use from time to time with patients for energy. But certainly I think about all of those behavioral things first, like ways to maximize energy. I didn't mention exercise, and I think it's really critically important to think about increasing physical activity. It's kind of counterintuitive. People think about exercising and becoming more tired, but exercise improves people's conditioning and kind of being active. And being active doesn't have to mean, running 30 minutes a day or doing the Stairmaster. It can mean walking around the house. It can mean taking a walk down to the mailbox or down to the end of the street. Kind of just getting more activity is a really important thing. And I think, one thing that I'm trying to think about as a clinician is how to balance, because I know sometimes it feels like a lecture, or it feels hard to hear, like, you should exercise more. And I think just finding ways to feel like that is an achievable thing that somebody could integrate. It's really, really important. I think it's really important for a whole host of health reasons. So those are my approaches to fatigue. I know there was another part of the question about pain management and how we think about pain management. There's not a short answer about this, but I think for pain management, we always are thinking about, my personal approach is always thinking about, how does pain affect somebody's ability to function? And then we treat and manage pain to maximize someone's function. So we're thinking about using kind of the lowest risk medications first, and thinking about medications like over-the-counter medications. They're not always without risk. As everybody hopefully knows, ibuprofen and Tylenol in certain situations can have risks, but those are sort of our kind of first line approaches to things. And then we have escalating types of medications for escalating amounts of pain. And we also have selective types of medications, like medications that help with nerve pain, for example, and inflammatory pain, in addition to the strong pain medicines like opioids that we use in certain situations for cancer-related pain. But I will say the main kind of philosophy is around treating to function. So I'm not treating usually to a number on a pain scale. I'm treating to helping somebody function and do the things that they enjoy in their lives. So I think that we're in a really interesting moment historically in terms of opioids and how they're used in cancer care in light of the opioid crisis that's happening kind of worldwide. And I think it's an important conversation to have on an individual basis with the clinician who might be prescribing as to when and how opioids could be appropriate. But I think there's absolutely a role for them for cancer-related pain. And I will say too, I use the least amount possible and help people taper off when they don't need them anymore.
Well, I don't have anything specifically to add about the medicine because, obviously I'm not a medical practitioner, but I do want to mention that I think it's really important to listen to your body and to ask for help when you need it. Every day you might not feel 100% every single day, but that's okay. I mean, there might be some days that you need to rest a little bit more, or if something is coming up, you might need to just take it easier, or have somebody help you with things so that you can save up your energy for, an event that's, coming up that's really important to you. So yes, I mean, definitely reach out to your healthcare providers for a medical intervention for, pain and fatigue, but also just think about, none of us, really want to change our lifestyles, based on lung cancer or any other disease. But you might have to just think about like kind of moderating things a little bit and saving big projects for days where you feel like you feel better and feel like you have tons of energy. And on other days, just take it a little bit easier and, ask for help and take care of yourself.